In this video I want to talk about drugs that increase alertness and attention, and these are our famous stimulants. So what are we using drugs for that increase alertness and attention? Well, famous indication is ADHD, attention deficit hyperactivity disorder. So we have an attention deficit, so we want to increase attention. This is the fairly most common indication. Another indication, less common, but still you're going to see this, narcolepsy. This is excessive sleepiness, and it's caused by a chronic neurologic disorder where the brain cannot regulate sleep-wake cycles. So this is narcolepsy, where patients just fall asleep suddenly. Now, how do these drugs all work that we use for the treatment of ADHD and narcolepsy, and that are stimulants? They have a fairly straightforward mechanism of action. They increase dopamine and increase norepinephrine in the central nervous system. So it's more central effects. And if you're thinking about what happens when we increase dopamine in the central nervous system, well, I hope you're going to come up with euphoria. You're going to feel very good, because it's also the positive reinforcement feeling. I want to do this again. Obviously, that leads to the problem potential for substance use disorder. What else? Abnormal movements, so repetitive movements, that's characteristic. And then also psychosis. We know too much dopamine can give us psychotic symptoms. What about norepinephrine? Well, if we have a lot of norepinephrine, that gets into fight and flight, so we're very agitated, aroused, agitation. And then there's also a decreased need for sleep. So if you're in fight and flight, you don't think about sleeping, they will lead to less sleep. As it relates to the stimulants for the treatment of ADHD and also excessive sleepiness in narcolepsy, there are really two major drugs. The first one is the famous methylphenidate, also known as a brand name Ritalin. And what does it do? It inhibits the dopamine transporter and the norepinephrine transporter. So if you are thinking about a nerve terminal here, and let's say that's a dopaminergic neuron that releases dopamine, well, there are always these transporters. This one is called DAT for dopamine transporter, taking back the dopamine once it's released. And what Ritalin does is just inhibiting this DAT. So that's Ritalin or methylphenidate. And so there's a less taken back, so you're going to have more available, more synaptic availability of dopamine. And the same holds true for norepinephrine. So we can say they increase dopamine and increase norepinephrine, and that helps us for the increased alertness and attention. So as it relates to adverse effects, let's start with increasing norepinephrine. We said, first of all, increasing dopamine by inhibiting that, but we also inhibit NET, and therefore we're going to get more norepinephrine. So let's start with norepinephrine. We already said central effect, we are more agitated. So as an adverse effect, we expect insomnia, we are more nervous. Also anorexia, we don't have as much appetite, which can lead to weight loss. But let's also think about peripheral effects like increased heart rate, which is also called tachycardia, increased blood pressure. And those are definitively dangerous if you have anyone with underlying cardiovascular abnormalities. So therefore we have here also a black box warning for serious cardiovascular disease, and obviously a contraindication. We should not take this in patients with uncontrolled hypertension or any other underlying cardiac abnormalities. Now, if you're thinking about increasing dopamine, here the major things that you're going to hear about is growth inhibition. It's really not a big thing. It's really very minimal. But a lot of people are going to ask you about this. Dopamine suppresses growth hormone. There's a very subtle difference if you compare kids that take this medication or not, but once you stop it, they catch up. It's really very minor, but still parents will most likely want to talk about that. So growth inhibition, and then obviously because you increase dopamine, there's always a risk for dependence. And there's another black box warning for abuse, diversion, and dependence, which should make sense because we just increase dopamine. So that's it for the drug Ritalin. Now the next drug that I want to discuss, another stimulant very similar, is amphetamine, and it has a similar, however not identical mechanism of action. It's a little bit more complicated. So amphetamine really gets into this nerve terminal. So let's suppose this is amphetamine. Amphetamine. So it gets in there, and then there are these vesicles where the neurotransmitters are stored, and we have here a transporter that's called VMAT. It's actually VMAT2. And so it turns out that amphetamines also can get here into these vesicles and in the end really replace the neurotransmitters. So they kick them out, so you're going to have a lot there, and then at one concentration, when there's so much of this neurotransmitters, this transporter can work the reverse way, and then you're going to have increased levels of dopamine. And certainly that's all holds true also for norepinephrine. And in addition, amphetamine also seems to directly inhibit dopamine, norepinephrine transporter, and even a little bit the serotonin transporter. But in the end, really what we're talking about is a very similar mechanism of action in terms of net effect compared to Ritalin. We're going to increase dopamine, and we're going to increase norepinephrine. And that's why these drugs work very well in the treatment of ADHD and also narcolepsy. And so everything what I said before for Ritalin, we can also now say for amphetamine as it relates to the adverse effect, as it relates to black box warnings, as it relates to contraindications in cardiovascular diseases, and also the risk of a substance use disorder. When we want to treat a patient with ADHD, the guidelines say usually the first line treatment is a stimulant, and we just discussed them. That's methylphenidate and amphetamines. Now, if that fails or if there's any contraindications, the patient could not take a stimulant, there's an alternative, and these drugs are called non-stimulants. And that's sometimes a bit confusing because if you look at the mechanism of action of these drugs, particularly if you compare bupropion and methylphenidate, it's actually exactly the same. They are also reuptake inhibitors. Bupropion inhibits norepinephrine and dopamine reuptake, same as methylphenidate. So what makes a stimulant, and why is bupropion not a stimulant? Well, it has to do with the onset of action. So it turns out that the stimulants have a very fast onset of action, so they work very quickly. And particularly in kids with ADHD, you give the drug, you see an effect. And that also has as a consequence that you don't necessarily need to give this drug every day. So if the kid needs this drug particularly for school days, you could not give it on a weekday or not give it in certain holidays because it just works immediately. Now for the non-stimulants, things are different. Non-stimulants are defined as drugs that have not a fast onset of action, and therefore they need to be taken regularly. It can take up to weeks to see an effect, and they also don't have a strong addiction potential. So let's look at these non-stimulants. So the first one is a drug, atomoxetine. It only inhibits NET. So if you're thinking here about an adrenergic neuron, we're going to inhibit this NET, this reuptake by atomoxetine. And then there's less reuptake, so we're going to have more norepinephrine around. And this drug is only approved for the treatment of ADHD as a non-stimulant, so it has not as quick of onset of action. You also need to take it regularly. And then in terms of adverse effect, very predictable. Well, we're going to increase norepinephrine, so we will be agitated, insomnia, nervousness, anorexia, not as much appetite, heart rate goes up, blood pressure goes up. Well, we just increase norepinephrine, so pretty predictable. The next non-stimulant that I want to discuss is a drug bupropion, which inhibits NET and DAT. So it inhibits this norepinephrine reuptake, bupropion, and also the dopamine reuptake. So it really acts exactly the same as methylphenidate, but it's a non-stimulant because it doesn't have such a fast onset of action and also not a high abuse potential, therefore. Well, what about indications? So we can use it for ADHD if the stimulant didn't work or if there's anything that prevents us from using a stimulant, but it has other very famous indications, and I hope you can come up with some. So I hear somebody saying it's also an antidepressant. And that's absolutely true. I also hear somebody saying it's used for smoking cessation. Correct. That's also a good one to know. Turns out that probably this increased levels of dopamine help if you want to quit smoking because it makes you feel good. What about adverse effect? So generally, when we're thinking about bupropion, there's one thing that always going to come up, and that's just super important. It increases the risk of seizures. So for adverse effect, increases risk of seizures. So it turns out if you have high levels of dopamine, some of these drugs can increase the risk of seizures, and bupropion is one of them. It has also a black box warning. Do not use in anyone with an underlying seizure disorder. Otherwise, well, it's also a CNS stimulant, so CNS stimulation. So a lot of things makes us more agitated. Things like insomnia can happen. So just quick summary, we discussed drugs to increase alertness and attention. These are our famous ADHD drugs. First-line drugs are things like methylphenidate and amphetamines, and they are considered stimulants. Second-line agents are so-called non-stimulants. They have very similar mechanism of action, and this may confuse some people, but you have just to consider that their onset of action is much slower. They need to be taken regularly, and therefore they are considered non-stimulants, although they almost do the same. And these are drugs like atomoxetine and bupropion. This finishes the video on the drugs for the treatment of ADHD and also narcolepsy. Thanks for watching. Bye-bye.